When those tests confirmed that AZT was highly active against HIV-1, Burroughs Wellcome began preclinical toxicology and pharmacology testing, leading to clinical trials and approval of AZT by the U.S. Food and Drug Administration in March 1987. Till this day, AZT has been a primary drug that, along with many others, is used for the treatment of AIDS and has the best chance of keeping HIV at bay. AZT may cause many symptoms. Majority of them are manageable and very common for those that receive this HIV treatment. These symptoms include nausea or occasional dizziness, vomiting, headache, loss of appetite, stomach pain, or cramps, and many more. The drug may also cause severe symptoms, for example, lactic acidosis, liver problems, myopathy, and blood disorders such as severe anemia or neutropenia. Other possible symptoms of AZT include changes in the immune system, called immune reconstitution inflammatory syndrome, or IRIS for short. IRIS is a condition that sometimes occurs when the immune system begins to recover after treatment with an HIV medicine. As the immune system gets stronger, it may have an increased response to a previously hidden infection. It also causes changes in body fat, including gain or loss of fat. As mentioned a bit earlier, patients treated with AZT may experience severe symptoms, specifically lactic acidosis and myopathy. Now let's talk about how they actually happen and what causes them. Patients with AZT-induced myopathy commonly complain of progressive generalized muscle pain, weakness, and fatigue. When biopsies, which is the examination of tissues within a human body to detect the presence of disease, are performed, ragged red fibers and structurally abnormal mitochondria can often be observed. It has been consistent that the treatment of HIV patients with AZT has an adverse effect on the patient, which causes mitochondrial DNA depletion. However, the mechanism behind mitochondrial DNA depletion and its role in AZT-induced muscle toxicity has been recently debated, and a conclusion has yet to be drawn. It has been long hypothesized that AZT-induced dysfunction of mitochondria is caused from the reduction of mitochondrial DNA content. Depletion of mitochondrial DNA has been reported in patients with AZT-related myopathy and has been shown to be reversible by withdrawing the drug. It has been assumed that the depletion of mitochondrial DNA leads to dysfunctional complexes of electron transport chain, which affects oxidative phosphorylation and ATP production. Due to this, aerobic respiration falls short in producing the minimum energy required to properly maintain normal tissue and organ functions, leading to dysfunction. As levels of aerobic respiration decrease, anaerobic respiration takes over to compensate for the low levels of ATP production. However, this leads to the buildup of lactic acid, which results in the patient having lactic acidosis.